Hello everyone, my name is Dr. Michael Albright. I'm an internal medicine doctor. Today I'll be discussing knee arthritis. What is knee arthritis? This talk will focus explicitly on knee osteoarthritis, the most common type of knee arthritis. Doctors abbreviate osteoarthritis as OA in their notes. For example, right knee OA. Osteoarthritis is a wear and tear condition where the cartilage in the knee becomes worn away over time. The knee joint is a space between two bones. The top bone of the joint is known as the femur. This is the long bone in your thigh. The bottom bone of the joint is the tibia. Now, this joint depicted here is not exactly the knee joint, but it gives you an idea of how it is structured. In between the two bones, the femur and the tibia, is the synovial space filled with synovial fluid. This helps provide lubrication to the joint. There's also cartilage, which helps to prevent the bones from rubbing together. The symptoms of knee osteoarthritis generally involve knee pain that is worse with walking, getting into or out of a chair, or climbing stairs. People with arthritis usually have morning stiffness that lasts less than 30 minutes at a time. If you have morning stiffness that lasts more than 30 minutes to an hour, it might be some other type of arthritis, such as rheumatoid arthritis. Knee osteoarthritis often gets better during rest, although it may not if the disease is advanced. People with knee osteoarthritis may have mild swelling of the knee. This occurs in some people, but not others. The symptoms get worse the more advanced the cartilage damage becomes. What can mimic knee osteoarthritis? Rheumatoid arthritis is an autoimmune condition where the immune system attacks your joints, and it can cause swelling and pain in the knee and damage to the knee joint over time. Gout or pseudogout, these are conditions where crystals from your bloodstream precipitate in the knee joint or other joints, and this can cause an inflammatory response from your immune system, and the knee generally becomes tender over the course of a few days and resolves with medication. Knee joint infections can occur. Doctors may call bacterial knee joint infections septic arthritis. Fever is often a symptom with knee joint infections, as well as swelling of the knee, and also the knee tends to be hot to the touch. Knee injuries can occur, for example, ligament or meniscus tears. Knee bursitis can occur. Whenever you see a word with itis on the end of it, by the way, itis means inflammation, and bursa, inflammation, is bursitis. So a bursa is a sac filled with fluid that lubricates joints. There are several all throughout our body. There are several in the knee joint, at least 3 per knee. And they can become inflamed. For example, if you work on your knees quite a bit, the front of the knee can become inflamed and exquisitely tender to the touch. Tendinitis can also occur. And then there's back or hip pain that can radiate to the knee and mimic knee pain. Cancer of the knee is very rare. What causes knee osteoarthritis? Well, often it has no clear cause other than wear and tear over time. It usually occurs in people over the age of 50. Being overweight or obese may make the disease occur at a younger age. It could develop as a consequence of other types of arthritis or injury. For example, damage from rheumatoid arthritis, septic arthritis, and others. How is knee OA diagnosed? A doctor diagnoses knee osteoarthritis using clinical history, a physical exam of the knee, and ruling out other possible causes with tests. This is not often needed if the osteoarthritis diagnosis is obvious. For example, a doctor may order a blood work analysis to rule out rheumatoid arthritis or other conditions like lupus. Knee fluid may be pulled off with a needle from the knee and sent to the lab for analysis. This could help diagnose things like gout or infection in the knee. Knee x-rays are the primary way to diagnose knee osteoarthritis other than the clinical history and physical exam. Depicted here is a normal knee x-ray. You can see the top bone is known as the femur. This is the thigh bone. The bottom bone is the tibia. The space between the two is the knee joint space. This is filled with synovial fluid. And cartilage lines the bottom of the femur and the top of the tibia normally. The fibula is the other bone in the lower leg. It's on the side of the leg. There's also the kneecap, which doctors call the patella. Look at the difference with this knee x-ray. The joint space is narrowed. This is because there's a loss of cartilage. Look at the difference in space between the picture on the left and the picture on the right. Also, notice that the bone next to the joint space is brighter white than other areas. This is because the bone next to the joint space is thickened. This is often seen in osteoarthritis. There's also this little hook of bone on the side here. This is known as a bone spur. Doctors call bone spurs osteophytes. It's an abnormal growth of bone that sticks off to the side, usually when osteoarthritis is present. How is knee OA treated? Weight loss is recommended if a patient is overweight. Exercise is very important. Physical therapy is often prescribed. A cane or walker can help with stability and also with pain. A cane normally would go in the hand opposite to the bad knee, and it should move forward when the bad leg moves forward. When you're selecting a cane from the store on your own, the cane should be the length of your wrist, where your wrist is, when your arm is at your side. So the top of the cane should be where your wrist is when your arm is at your side. Finally, medication is how you treat knee osteoarthritis pain. And knee replacement surgery is frequently performed for this condition, especially in severe cases. I just want to quickly note how to navigate stairs with knee osteoarthritis. So when you're climbing stairs, the good leg should go first, and you should take it one stair at a time. Don't take it right, then left, then right, then left. Go up one stair with your right foot, then the left, if the left knee is the bad knee. When you're descending stairs, it's actually the bad leg that should go first. And again, you should take it one stair at a time, with both feet stepping on one step at a time. If using a cane, up the stairs or down the stairs always make the cane go forward when the bad leg does, just like when not using stairs. What kind of exercise should you do for knee arthritis? Well, low impact aerobic exercise is good, such as walking, biking, or swimming. Pool exercises are good as this takes the weight off the knee, so you could walk in the pool, for example. Quadriceps strengthening exercises. Tai Chi. Actually, one study showed equivalence with physical therapy. And yoga. You should avoid running and step aerobics. Topical treatments. Topical means that the medicine is one that you rub on your skin. In this case, it would be a medicine that you rub on your knee. Diclofenac gel, also known as Voltaren gel, used to be by prescription only, but is now over the counter as well as by prescription. This is a topical NSAID. So NSAID stands for non-steroidal anti-inflammatory drugs, and this medicine is applied up to 4 times per day to the knee. The advantage of this is that there's fewer side effects than taking the NSAIDs by mouth. Oral NSAIDs or NSAIDs taken by mouth include Aleve, Advil, ibuprofen, Motrin. Another topical treatment for knee arthritis could be a menthol-containing product like Biofreeze. This may produce short-term relief. Capsaicin cream may or may not help. It typically causes a burning sensation when applied. Most of the time in my practice, I have prescribed diclofenac gel, although I've certainly had patients try multiple different products topically to try to get relief from the pain. Oral NSAIDs. So we talked about this a little bit on the last slide. NSAIDs are non-steroidal anti-inflammatory drugs. Examples include ibuprofen with brand names of Advil and Motrin, naproxen with a brand name of Aleve, celecoxib with a brand name of Celebrex. Celebrex, unlike the other NSAIDs, has a lower risk of stomach ulcers and bleeding. There's also diclofenac pills. There's many others. These medicines are considered probably the most effective medicines for knee osteoarthritis pain. However, you have to have good kidney function in order to use them. They can cause stomach ulcers or bleeding, especially if too many are taken. You should take this type of medicine, these NSAIDs, with a medicine to reduce stomach acid, such as omeprazole. The brand name of omeprazole is Prilosec. Other oral medications that are sometimes used to try to help with knee osteoarthritis pain include acetaminophen or Tylenol. It's generally considered to be modestly beneficial. Tramadol is a prescription-only medication. It's a weak opioid pain medication. It also has other pain-killing properties. When the NSAIDs don't work or if you can't take them, often doctors prescribe this type of medicine. Duloxetine or Cymbalta is an antidepressant that also has pain-killing effects and has been found to be helpful for some patients with knee osteoarthritis pain. Full opiates such as hydrocodone, oxycodone, morphine, fentanyl, Dilaudid, these are not generally recommended by any guidelines to treat knee osteoarthritis. Knee injections are often performed to at least provide temporary relief of pain. Doctors know these types of medicines as glucocorticoids or glucocorticoid injections. A doctor may also call them steroid injections. A lot of lay people or patients call these injections cortisone injections, although the injections do not actually contain cortisol. If you said steroid injection, that would probably be the most accurate for both doctors and patients alike. So what's actually injected is triamcinolone, which is a type of corticosteroid or glucocorticoid medication. Kenalog is the brand name. There are others that could be injected as well. It depends on the doctor's preference. An anesthetic agent is often injected as well along at the same time as the steroid, such as lidocaine. This medicine works by reducing inflammation in the joint, and reducing the inflammation in the joint can in turn reduce the pain. These injections typically provide benefit for about a month, but the results are highly variable. I've had some patients who've experienced no benefit whatsoever, and I've had some patients tell me that these injections work like a charm and they get them about every 6 months or once a year. You can administer these every 4 months, but more often could cause joint damage or shrinking of the cartilage in the joint. Another option for a knee injection is hyaluronic acid injections. There are several brand names of this type of injection, including Synvisc, Euflexa, Hyalgan, and others. This type of injection works by lubricating the knee joint and providing shock absorption. The number of injections that are administered depends on the brand. For example, some of them you inject once a week for 3 weeks. Others are less frequent than that. Again, the results are highly variable with this type of injection. I wanted to briefly talk about stem cell therapy, as sometimes my patients have asked me about this. Stem cells are considered experimental. Their effectiveness has not been proven in large clinical trials. They are probably not going to be covered by insurance for you, and they can cost anywhere from around $2,000 to $10,000 out of pocket, depending on where you try to get this therapy. Anecdotally, I've had a few patients that have done this, and most did not have a benefit. Some said they did, but I just want you to be aware that it definitely won't help everyone, and it may cost you thousands of dollars out of pocket to find out if it does. So let's also talk briefly about knee replacement. Knee replacements in doctor's parlance is known as total knee arthroplasty. For patients who have severe pain, this may be the solution, especially despite non-surgical therapies. Patients need several weeks of physical therapy following the procedure. Usually the pain gets much better in the knee after the recovery phase of this surgery is over. The image on the right is actually not a real image. It's generated by artificial intelligence, but it kind of gives you an idea of what the knee joint is like after a knee replacement. So the cartilage damage is removed from the edges of the femur and the tibia bones, and then bone cement is used by the orthopedic surgeon to apply the knee replacement parts. And as you can see, there's no cartilage anymore, and instead what you're kind of replaced with there is some metal components. Thank you, and please consider subscribing to the channel.